Thank you, Julianne. Good afternoon. I'm James Bell. I'm CEO and a co-founder of HandMinder. Today, I'm going to share with you how HandMinder is helping stroke survivors re-engage their brains and reestablish their quality of life and their role in society. Every year across the globe, 15 million people are victims of stroke. 12.5 million of those survive, and 795,000 are right here in the United States alone. Now, this comes at a medical cost each year in the United States of nearly $74 million. Now, the goal with these patients, as I said, is to help them reestablish their quality of life and their role in society. Unfortunately, 60% of them have hand dysfunction. This means that typically it's their dominant hand that's dysfunctional, and so they have difficulty eating or drinking, dressing without the help of somebody else, or hugging a loved one. Unfortunately, the devices and therapies available today are simply insufficient. First of all, they're inconvenient. The stroke survivor and his caregiver have to go several times each week to a rehabilitation clinic or a doctor's office for their treatment. This causes great upheaval in their lives. Furthermore, these therapies and the devices in particular are difficult to use. So stroke survivors and their caregivers often tell us that they just give up on the devices, which means their rehabilitation time is lengthened, and that's if they recover at all, and it gets worse. The cost is very expensive. The cost ranges anywhere from $350+ an hour, several times a week in a clinical setting, to devices that start at $10,000 and go upwards of hundreds of thousands of dollars. But folks, that's not the worst of it. The great travesty here is that none of these devices actively engage the patient's brain. In other words, the patient can sit back and relax and receive a passive therapy. They can even take a nap while they're being manipulated by a therapist or by a machine. So what we're really doing here is addressing a largely neurological problem with localized muscle exercise. And the science, in fact, shows that active brain engagement is better than traditional therapies. In fact, in a recent study in Topics on Stroke Rehab, that was published in Topics on Stroke Rehab, it showed that patients increased the use of their hand by 2 times or 100% when they were engaged in active brain engagement and used meaningful task-oriented exercises versus traditional therapies. What's more, their movement quality, in other words, their preciseness of movement, improved by 150% or 2.5 times versus traditional therapies. And by the way, this is all over the course of an 8-week period. So it's with this science in mind and with the research of our own scientists at HandMinder that we created a solution, that we created the first device that provides active brain engagement for stroke survivors with hand dysfunction. And so I present to you the HandMinder portable hand rehabilitation device. Now what you're looking at here on the left side of the screen is our first prototype. And then you see a quick sketch and a rendering of our third prototype. Now you'll notice some differences between the two because in our customer discovery, we found, first of all, that in fact stroke survivors' hands that are dysfunctional, it's difficult to put a glove on. And so we moved more to a skeleton design for the glove, and a glove that opens from the sides so that you can put the hand in more easily. But the other thing that we discovered was that patients told us and their clinicians told us that the device could not look very obtrusive. The device couldn't look very obtrusive because many of these patients are over 60 years old and have grandchildren. And they were afraid that the grandchildren would be afraid of their grandparents. So we've talked to grandchildren. We showed them the third prototype and they're very excited. 100% of the grandchildren that we've showed so far said, "Grandpa's cool again." So let's talk about how this device works. So we have 12 micromotors placed on each side of the fingers and on the wrists. And with these 12 micromotors, we provide vibrations in various combinations to the patient's hand. Now, the motor receptors in the hand pick up that vibration. They send the signal up to the brain. The brain now is actively involved in the therapy and sends motor signals back to the muscles in the hand and the arm to make movements, and the patient performs meaningful task-oriented exercises. So now we have a device that really has actively engaged the brain. We have closed the natural physiological feedback loop. Now, not only have we closed the natural physiological feedback loop and actively engaged the patient's brain, we've made a convenient device. Yes, you can use it in a doctor's office and you can use it in a rehabilitation center, but you shouldn't be restricted to those places. You can take HandMinder home. HandMinder is portable, so the patient, the stroke survivor, can take it home. They can stick it in a bag, take it anywhere they want. They can get their rehabilitation anytime, any place, anywhere. In fact, you can take HandMinder on vacation. So we talked about price of the other devices in the marketplace. Let me remind you, those prices ranged from $10,000s of dollars to hundreds of thousands of dollars. We're at a price point of $1,200 because this device will be for one patient as opposed to one that might be used for multiple patients, and also because we wanted to be affordable for the patient. Here's how we stack up against the competition. First of all, we do actively engage the patient's brain, as we discussed, which is very important because it provides optimal therapy, helps the patient rehabilitate quicker, and then also we are easy to use. This has been a very big focus for us. You have to have an easy-to-use device so that the patient does not quit using it. Then we're portable, as we discussed, which means we're convenient. You can use HandMinder anytime, any place, anywhere. And finally, we're an affordable product. Here's how we're going to go to market. First, we are conducting clinical trials at 4 different sites. And with the information from these clinical trials, we will publish in reputable and the most prominent journals, such as Topics in Stroke Rehabilitation. Now, this information, of course, gets out to the neurologists and the physiatrists, that's your doctor of physical medicine, and physical therapists and occupational therapists who will be taking care of these patients. We're also going to conduct a media and advertising blitz. We're going to talk to media and get the word out so that patients can pressure their clinicians and say, this is something I want to use, that I need to use so I can rehabilitate better and faster. And of course, we will advertise in the very journals and magazines that the clinicians look at most often. We're going to engage professional organizations such as the American Stroke Association and the National Stroke Association to get the word out, and we are going to attend medical conferences where these clinicians go to learn more about their trade and what's new. And then finally, our primary target, our initial primary target will be primary stroke centers. There are about 6,000 hospitals in the United States. 1,000 of them are Joint Commission accredited, designated stroke centers. Most people live within an hour or 2 of these stroke centers, so that's where most patients of stroke go. And we will, with our direct sales force, target these stroke centers first. Now let's talk about the good part. How much money can we make? There are, as I said, 1,000 stroke centers in the United States. If you look at the average U.S. stroke center, they see every year 382 patients that have a stroke, survive that stroke, and then have hand dysfunction as a result. So multiply that times our $1,200, and each one of these 1,000 stroke centers has a potential revenue of nearly $500,000. And now let me remind you, we've narrowly focused our target market at this point on stroke survivors. Think about traumatic brain injury and other conditions that deal with that are truly neurological in nature. We can expand our market. And this doesn't take into account the patients that are not going to the primary stroke centers. Here's the management team that has brought HandMinder to you. I'm James Bell. I'm the CEO of HandMinder. I have over 2 decades of experience in the biomedical device industry. In the biomedical device industry, in management, operations, and sales. And I am a MBA candidate at Christian Brothers University, where my concentrations are in biomedical management and entrepreneurship. Also, Dr. Yu Liu is an MD and a PhD. Dr. Liu is the inventor of HandMinder. He has over 30 years of experience in neuroscience research and is an associate professor of anatomy and neurobiology at UT Health Science Center. Also, Dr. Randy Nelson, who's a PhD and has over 35 years of experience in vibration-guided therapy technologies, research in that, is a professor also of anatomy and neurobiology at UT Health Science Center. And Dr. Nelson is also the Associate Vice Chancellor of Research at UTHSC. Next up, John Denton has over 20 years supporting Dr. Nelson's research and is the research lab manager at UT Health Science Center. And we certainly could not have done everything we've done so far without our mentors, starting with Julianne Burns, who introduced us. She has nearly a decade of experience in biomedical device marketing and product management. Greg Mitchell, who you've seen earlier, has over 30 years of experience in companies from startups to Fortune 100 companies, and specifically is an expert in strategic management and product management. And then finally, Mr. Buck Brown, who's a Harvard MBA and is the president and CEO of iScreen Vision, and took them from startup through their first sale to their CE mark recently. So here's what we've achieved in our first 90 days. First, we've gotten our coveted provisional patent. We've identified a reimbursement strategy for our product, and we've developed our second prototype and are now started on our third prototype. And then finally, we've selected our prototype manufacturer for our third and fourth prototypes. That's Porticos Engineering in the Research Triangle in North Carolina. They have specific experience with products that are used with the hand and in ergonomics, and two of their biggest, and in miniaturization, I might add. And two of their biggest customers are Becton Dickinson, which is a medical device maker, and Motorola. So here's what we're asking for from you to help these patients. We're asking in 2 phases. First, for $600,000 for pre-commercialization to complete our third and fourth prototypes, and also to file for our non-provisional patent. Also, to file for our FDA clearance and our CE mark, and then finally, to conduct our clinical studies that would be completed by the second quarter of next year. For phase 3, we're asking for $1.9 million so we can get HandMinder into the market and to help these patients. That'll be for our first production run and for our media marketing blitz that we talked about earlier, to be completed by the end of Q3 next year. And then by the end of next year, we'll have trained our sales and clinical force and made our first sale. Now, in the last 12 minutes, 160 people across the world have had a stroke, they've survived, and they now have hand dysfunction. There aren't many tools out there for these patients. It says a physical therapist at Kirby Pines, which is a large center here in Memphis with a large rehab population, Rachel Graves, told us, she said, I'm really excited about this technology because today there isn't much out there to help these patients. Today, HandMinder has brought us a breakthrough product that will help them. We need this product today. And so we're asking you to invest in us, join us to help these patients reestablish their hand use and the quality of their lives and their roles in society. On behalf of the entire HandMinder team, thank you for your time and consideration, and we look forward to speaking with you at the break and at the reception this evening.